Good morning, everyone. Welcome to Enlace General Meeting. My name is Natalie Marles. I'm a health insurance navigator and paralegal advocate for Charlotte Center for Legal Advocacy. And also the Enlace chair for 2020-2022. Welcome to our general meeting. Enlace is a coalition of organizations that serve the Latino and Hispanic community in Charlotte metro area, and we meet every third Wednesday of the month from 9 a.m. to 10:30. I would like to invite now the Vice Chair Alicia Emmons, who will read our mission and vision of Enlace. Alicia.
Good morning, Enlace. I'm Alicia, the Vice Chair. So Enlace's vision is to enhance social capital within the Latinx community in the Charlotte metro area. And the mission is to develop and strengthen connections through information, collaboration, and partnership with organizations and leaders who serve the Latinx community. So that's a little bit about what Enlace is all about.
Good morning, Enlace.
Go ahead.
Good morning, Enlace. My name is Ruth Santana. I also work for Charlotte Center for Legal Advocacy in the Immigration Justice Program. And for Enlace, I'm also the public safety and also in terms of laws coordinator. And for this month's meeting, we're going to be discussing open enrollment. And we have two guest speakers with us. The first one is Andrea Mora. She's a health insurance navigator at Charlotte Center for Legal Advocacy. She has a master's degree in public health and is passionate to help minority communities in Charlotte, North Carolina, focusing on assisting individuals with access to health insurance and other public benefits. And our other presenter today is Devin McGoy, who is an outreach assistant and certified health insurance navigator for Charlotte Center for Legal Advocacy. He's also bilingual and conducts the intakes for navigator appointments and coordinates the team outreach to Charlotte community. So now I will then leave you with them to do their presentation.
Hi, good morning, everyone. We're happy to be here. Thanks for having us. So I'm going to go ahead and share my screen. All right. So Devin and I are here from the Charlotte Center for Legal Advocacy to talk about open enrollment. It's coming up starting November 1st. So we want to discuss with you different ways that you can help your clients refer them to us so we can help them enroll in health insurance programs. I'll go ahead and let Devin start with the agenda.
Sure, thanks, Andrea. And good morning, everybody. My name is Devin. As Ruth said, I'm an outreach assistant and health insurance navigator at the Charlotte Center for Legal Advocacy. And we're really excited to be here to share what we're working on in helping connect people with healthcare coverage through the Affordable Care Act. So today we're going to go over a few key aspects of the Affordable Care Act and how you can get help signing up for a health insurance plan during the open enrollment period that starts November 1st. So first, we're going to go over how the ACA works, what the key protections are, the fact that it still is the law. Then we're going to talk about eligibility under the Affordable Care Act and eligibility for financial assistance, in particular, immigrant eligibility and public charge. Then Andrea is going to take over and talk about Medicaid transformation and just general Medicaid issues in North Carolina. And lastly, I'm going to talk about the marketplace enrollment process and how we can help if you would like some assistance with it. All right, so if there are two things that you take away from this presentation today, I want it to be that the Affordable Care Act is still the law, first, and second, that free assistance is available to help you find the best plan for you and your family, and financial assistance as well. So first, I want to talk about how the Affordable Care Act or ACA protections are still in place. The Affordable Care Act, despite numerous legal challenges over the years since 2010, is still the law, and its protections are still available to all Americans. The first is that coverage cannot be denied, or insurance companies cannot charge more for pre-existing conditions. This is really the pillar of the Affordable Care Act, that despite having a pre-existing condition, you cannot be denied coverage or charged more. The second is that premiums can only vary based on a few factors, such as your age, where you live, and whether or not you're a smoker. Additionally, the Affordable Care Act prohibits annual and lifetime limits on care and how much can be spent on your coverage. Also, plans must cover certain preventive services without cost sharing. So that means things like an annual wellness visit or mammograms must be covered by your insurance plan, and you cannot be charged for those types of things. And then lastly, financial assistance is available. We'll go into more details of how exactly that looks, but the federal government provides tax relief, or what are called premium tax credits, to individuals who are eligible for financial assistance from the government. Next slide, please. Okay, so under the Affordable Care Act, there are 10 key essential health benefits that must be covered. Every health plan that is marketplace eligible must contain these plans must contain these benefits. All of them are listed here, such as emergency services, prescription drugs, hospitalization, lab services, oral vision care for children. All of these things are essential health benefits that must be included in every plan that is offered on the health insurance marketplace. Next slide. So I mentioned just a minute ago that the marketplace allows, or one of the most popular benefits of the Affordable Care Act and the health insurance marketplace is the fact that lower costs are available, or cost reductions are available, financial assistance, that is, sorry. The main one that the largest number of people can qualify for is advanced payments of the premium tax credit. So if your household income is between 100% and 400% of the federal poverty line, and I'll show you a table of that in just a second, you can qualify for these premium tax credits, which means that come tax time, the amount of tax that you owe to the government is reduced. Or if you opt for advanced payments, you can reduce the amount that you pay each month for your health insurance plan or your premium upfront before tax time. So as it says here, the advanced premium tax credits, or APTCs, can help people pay their monthly premiums just month by month. They're paid in advance directly to the insurance company. So there's very little that you have to do besides make sure that everything looks good with your taxes come tax time. And lastly, the amount can vary depending on how much you make between that 100% and 400% of the federal poverty line. Additionally, for folks who have income below 250% of the federal poverty line, further cost sharing reductions are available. And these cost sharing reductions reduce the out-of-pocket expenses that you may incur month to month through your health insurance plan, specifically your deductible, your out-of-pocket payments, your co-pays, co-insurance, things like that. So anything that you pay out of pocket can be assisted through the cost sharing reductions. And again, that's only for individuals and families below 250% of the federal poverty line. Next slide, please. Okay, so just for your reference, this is what the federal poverty line looks like for individuals of various household sizes, as you can see on the left-hand column, and then various percentages of the federal poverty line going in the columns to the right. So anybody who falls in between these categories, again, 100% and 400% of the federal poverty line, can qualify for those premium tax credits. And anybody below 250% can qualify for the further cost sharing reductions. Now, one thing that is important when it comes to immigrant eligibility for this is that in North Carolina, specifically, there is a 5-year bar on immigrants receiving Medicaid benefits. And so if an individual is an immigrant within that 5-year period, so has arrived in the United States within the past 5 years and cannot receive Medicaid, they can still receive financial assistance on the marketplace, even if they don't fall into this window. That is, if they fall below the federal poverty line, they can still receive assistance from the marketplace, even though they're not in this traditional 100 to 400% category. Next slide. Okay, so I want to talk briefly before we go into immigrant eligibility about who should apply for a plan on the health insurance marketplace and who is eligible for that financial assistance. First, anybody who is a US citizen or a lawfully present immigrant is eligible to sign up for a plan and receive financial assistance on the health insurance marketplace. And Andrea will talk a little bit more about what it means to be a lawfully present immigrant. So again, as I mentioned before, income must be between 100% and 400% of the federal poverty line, with that one exception for recently arrived immigrants. And an individual or a household must have no offer of affordable employer-based coverage. So this means that you can't have an insurance offer through your job or through your spouse's job or through your parents' job that is considered affordable. The definition of that can be a little dicey. So if you have questions, we're always available to discuss that. But if you do not have affordable employer-based coverage, then you're eligible to get a plan on the marketplace. Lastly, an individual must not be eligible for public coverage. That is like Medicaid, which is run by the state of North Carolina, Medicare for retired folks, generally over the age of 65, the Children's Health Insurance Program, or CHIP, or veterans benefits or veterans health coverage.
All right, thank you, Devin. So now I'm going to go into a little bit about marketplace immigrant eligibility. As he mentioned, any lawfully present immigrant is eligible for the health insurance marketplace and for financial assistance. As we mentioned, the APTC advanced premium tax credit, and if your income is below 250% of the federal poverty level, you'd be eligible for the cost share reduction. So lawful presence is very broad. There are many statuses that do qualify. Even individuals who are pending application for a status may be eligible to enroll in the marketplace and get financial assistance. And as Devin mentioned, certain non-citizens are eligible for the tax credits, even if their income is below 100% of the federal poverty level. And that is due to them not being eligible for Medicaid due to their immigration status. There are many access barriers for immigrant families, one of them being a mixed status family. Parents who are ineligible for Medicaid or health insurance programs, they may be hesitant to apply for marketplace coverage or other public benefits, but it should be noted that these families can still apply for the eligible children or the eligible family members, and they will not need to provide information about their immigration status. So that is a very important detail, and also any information that is submitted in the marketplace for verification of immigration status, it is never reported to immigration enforcement. So there should be no fear about that being communicated. And there's also another common fear with the use of the health insurance marketplace, and that is public charge. So for some immigrants, the USCIS does not apply a public charge analysis. And specifically for the health insurance marketplace, it is not considered one of the programs that is counted against you with the public charge. So individuals should not fear public charge when they are enrolling in the health insurance marketplace. And lastly, the recipient of public benefits by US citizen children will not directly be a factor in a parent's public charge test. And that could be because in the marketplace, when you complete an application, if the children are found eligible for Medicaid, the application will be referred to their local Department of Social Services office, and they'll be evaluated for Medicaid. I want to just bring it up that Medicaid for children and Medicaid for pregnant women are not programs that are considered a public benefit in the public charge. So there should also be no fear regarding that, but we're here to help individuals, clarify that, and just give them peace of mind about it. So I'm going to switch over to Medicaid and how our state is a non-expansion Medicaid state. And what that means is for individuals who have income below 100% of the federal poverty level, they are not eligible, as Devin mentioned, for the advanced premium tax credit. And in some states, they would be eligible for Medicaid. However, North Carolina has not expanded Medicaid to these individuals. So they need to have very low income. Medicaid for adults is usually for caregivers and parents of children under 18, and their income has to be very low. For individuals who are aged, blind, or disabled, they may qualify for Medicaid. Here's a graphic that you can kind of put everything into perspective. So there's the group that is above 100% of the federal poverty level, and they would be eligible for marketplace subsidies that will help them have affordable health insurance. But then there's the Medicaid, where your income has to be around 47% of the federal poverty level. So individuals between the 47% and 100% have no options for coverage because they make too much for Medicaid, but the marketplace subsidies are not available to them because they don't make enough money. So this is the group that we call the Medicaid Coverage Gap. And we do want to mention that lawfully present immigrants and eligible for Medicaid because they're waiting on that 5-year bar that we mentioned, they may still be eligible for the marketplace subsidies, even if their income is below 100% of the federal poverty level. So Medicaid eligibility categories, as I mentioned, there's Medicaid for pregnant women, for children under age 21, for low-income parents, caregivers, caretaker relatives of children under 18, those who are disabled, elderly. And then there's more limited programs. Family planning Medicaid is what individuals who are between that 47% and 100% of the federal poverty level are given as health insurance, but it only covers family planning services. So it's not a full plan, and that's where the health insurance marketplace can benefit them. And other limited programs, there's qualified Medicare beneficiaries. So there's several programs available for individuals with low income who are enrolled in Medicare. So Medicaid Transformation in North Carolina. So under the Affordable Care Act, states have the option to expand their Medicaid program to cover all low income families. And as I mentioned, we have not expanded our Medicaid here in North Carolina. So it's only available to the groups mentioned previously. And because of these restrictions, Medicaid only covers 30% of low-income adults in the state. So we'll go over how to enroll. There are 4 ways to enroll, and the main one I want to make an emphasis to the website healthcare.gov. There are a lot of phony websites out there that can be confusing to consumers, so we want to make sure that you emphasize that it's healthcare.gov, and individuals can apply online, they can apply over the phone or by mail. Our group at Charlotte Center for Legal Advocacy, we offer free assistance during the enrollment process. So we sit with individuals and assist them with the application, creating an account, and reviewing all of their plan options. And I'll go ahead and turn it over to Devin to go over the assistance.
All right, so this is my favorite thing talk about because this is what I spend my day organizing. So individual assistance is usually offered in normal times in person. Our navigators go to various sites around the community and help individuals sign up for a healthcare plan by showing them options in person. But unfortunately, because that is much more difficult to do today with the public health crisis, we are offering almost all of our personalized assistance over the phone. Which for many consumers is a bit easier because they don't actually need to travel to any location to meet with us. So just want to emphasize that all of our individual assistance is currently offered over the phone at any location that's convenient for you. So individuals can meet with a navigator, such as members of our organization, or certified application counselors, or CACs, to go over their healthcare options. Those two types of individuals, navigators and CACs, are very, very similar, but the type of individual, or the staff members that we have are called navigators. So both CACs and navigators provide objective, non-biased information about all healthcare options available. So our job is to help you determine what your options are and not show any preference on our behalf to those options. It's really up to the consumers to decide what is the best option for them. We're just there to help make sure that they know all of the options that are available to them. So both CACs and navigators are also responsible for educating consumers on how insurance works and also help families choose a plan that better fits their needs. So we do outreach and marketing activities like these just to spread the word about the open enrollment period and the Affordable Care Act. And we also help people to see if their current plan is actually meeting their needs and whether or not they can sign up for something that may be more affordable or provide them better access to doctors that they like, things like that. Lastly, our individual assistance is available all year round, not only during the open enrollment period. So if you happen to qualify to sign up for a healthcare plan outside of the open enrollment period, what's called a special enrollment period, we can help you sign up for a plan that way. Our organization also helps with Medicaid applications, and we do various other types of public benefits assistance. But the most important thing that I want to emphasize right here is that we can help you sign up for an affordable plan during the open enrollment period starting November 1st through December 15th. Those are the key dates, November 1st through December 15th, to sign up for a plan during open enrollment on the ACA marketplace. All right, so as I was just mentioning, there are a few timeframes when you can enroll for healthcare coverage. The first and easiest is during the open enrollment period. Again, November 1st through December 15th. This is when anyone can sign up for a plan on the health insurance marketplace and see if they are eligible for financial assistance through the premium tax credits. Additionally, at other points during the year, you may be eligible to sign up for a new plan or to just choose a plan entirely during a special enrollment period. Usually, this is within 60 days of a specific qualifying life event. Some examples are listed here, such as getting married, having a child, losing previous coverage, such as like through your job, gaining an eligible immigration status, such as obtaining a green card or becoming a citizen, going through a permanent move, so moving to an area where different health plans are offered, being a victim of domestic violence, or being released from incarceration. Recently, they released a new special enrollment period in response to the public health crisis, what we call the FEMA special enrollment period, which allows an individual since January 1st to sign up for a new plan. So if that may be applicable to your case, you can contact us and we can help you. Or since open enrollment is starting so soon, that is another period when you can sign up for health insurance to start in 2021. Lastly, Medicaid and CHIP are other programs that you can sign up for depending on your income. Medicaid and the Children's Health Insurance Program, or CHIP, are for low income families and the other groups that Andrea mentioned earlier. And you can enroll in those two programs any time of the year. There's no limits on that. Okay, so if you or someone you know is in one of these groups, you can refer them to our organization. Just tell them about us and our phone number, which I'll put up here in just a second. And we can help them apply for coverage. So first, anyone who is uninsured, especially with all the uncertainty these days regarding the public health crisis and the economic crisis, being uninsured is a real risk. It is at any time of the year, but especially in this crisis that we're going through. So if you or anyone you know is uninsured, we can help apply for coverage that is affordable. So this can be somebody who just wants to see what their options are. If they are in need of some free or low cost clinics resources, say if their health insurance plan is unaffordable, or if they are seeking exemptions from the tax penalty that was in place a few years ago, we can also help with that. Additionally, current marketplace enrollees should talk to us or should at least consider signing up for a new plan on healthcare.gov. You have to renew your coverage, and you have so that you don't want to just automatically re-enroll into last year's plan, because sometimes the health insurance company will, sometimes the prices will go up, or sometimes the health insurance company will put you in a similar plan, but the prices again will go up. So it is best to look and see what your options are every year, starting in November. If you have questions about your plan benefits, or you need to see if you need help locating a hospital or another provider that's in network, that would also be a good person to talk to us. Or if you have billing or claims issues, or if you somehow lost your financial assistance on the marketplace, we can also help see what we can do to figure out what's going on there. Lastly, any individuals who anticipate losing coverage. For example, if you think that you might lose your job due to the economic uncertainty these days and the insurance that comes with it, or if your children are going to age out of Medicaid or the Children's Health Insurance Program, if you anticipate that you're going to lose your healthcare coverage, we can help address those issues and help you sign up for a new affordable plan. Next slide. Okay, so as I've been emphasizing a million times at this point, open enrollment is coming up and we are ready to help. Open enrollment is November 1st through December 15th, and that is the key time frame to sign up for an affordable health insurance plan on the marketplace. So what we do at our organization, the Charlotte Center for Legal Advocacy, or CCLA, we offer phone and Zoom appointments, whichever is most comfortable and preferable for you, at convenient times of the day. So we have appointments in the morning, in the afternoon, and the evening. The appointments usually take about an hour and a half, or if you're signing up for a few individuals independently in your household, maybe allow for 2 or 2.5 hours in order to make sure you're not rushed when trying to choose a plan. Our navigators are bilingual. We speak English and Spanish, but interpretation is also available in over 150 languages through Language Line, a phone interpretation service that we use. Lastly, our organization, CCLA, can help individuals in 3 counties surrounding the Charlotte area: Cabarrus, Mecklenburg, and Union counties. If an individual lives in a county outside of this area and needs help, we can refer to an organization that can help. But just due to federal restrictions, we can only help in these 3 counties. Okay, so the NC Navigator Consortium is the large group of navigators and certified application counselors who can help you enroll in coverage anywhere across the state of North Carolina. And CCLA is a member of this consortium. So if you don't fall into our area of expertise, Cabarrus, Mecklenburg, and Union counties, we can refer you to an organization that can help outside. So there are 2 ways to schedule an appointment with us through this consortium. First, you can call this phone number, 1-855-733-3711. That phone number will send you to a call center that will direct you to appointments in your area and in the language that you prefer. I believe this phone number is answered in both English and Spanish. And lastly, you can also go to ncnavigator.net and select free assistance to schedule an appointment with a member of our organization. Next slide. Okay, so here's just a little graphic or flyer that we have designed for your use and for this time period. Again, you have the dates for open enrollment here and the information. You might see these floating around social media or around town. We're starting to distribute this flyer pretty widely. And I believe we can provide some flyers to Enlace to distribute as well afterwards. All right, so that brings us to the end of our presentation about the Affordable Care Act and Medicaid and how to get insurance and free assistance in signing up for a plan. The phone numbers and website are right here for your convenience. If you or someone you know wants to set up an appointment with a member of our organization, again, it's free over the phone, and we will help you determine your options. So I believe we will transition to some questions now, if there are some.
Devin, Andrea, we actually have one question, and this is like, what type of information or documents do they need at the time of the appointment?
It's a great question. I think since Andrea has done more marketplace appointments, I'll let her answer that.
Sure. So when you are scheduled for your appointment, you would want to have the information about your family, your household size, regarding how you file taxes. So it's nice to have your last tax return. It would be very helpful to have pay stubs available so that we can accurately estimate the income. And for members applying for coverage, you would want to have name, date of birth, Social Security, or immigration information available. And I believe that would be all. If you do, when we compare plans, if you do have medications or preferred doctors, we can always make sure that they are in network and that the health insurance plan that you're selecting will cover those services or prescriptions that you need.
Thank you. The other two questions that we had, one was if we have navigators that speak Spanish, but I think Devin answered that question when he mentioned that if yes, we do. We have a Spanish speaker. I'm one of those, Andrea as well, and Devin. We all three speak Spanish, and we also have two more navigators that speak Spanish. And as Devin mentioned it, we have a language line in case there is a language that we don't speak. We will be able to assist either way through that line. And the other question was about if we are not doing any in-person events, how to get an appointment with a navigator. And Devin explained that we can do a phone call appointment or a Zoom appointment, which wherever the consumer prefer. I have another question that just came in is, will all of family members have the same insurance plan?
I'll go ahead and answer that one. So not all family members will be required to enroll in the same health insurance plan. When you're comparing your options, you have the option to enroll, let's say, someone who has a little bit higher medical needs. You can enroll them in a higher coverage plan, such as a silver or gold plan, or you can enroll the other members in a bronze plan that has higher deductibles. So you can mix the different groups for your family members. And also if let's say the children are eligible for Medicaid, they would be referred to Medicaid, but the parents or caregivers can enroll in the marketplace insurance. So it's not limited to one specific plan for the whole family. You can choose multiple plans depending on your needs.
Thank you, Andrea. I don't know if Devin or you can mention like a brief summary in Spanish for everyone that is watching this video and do not speak English, how they can get assistance for open enrollment and all the information. Just a brief summary.
I can go ahead and do that. Hola a todos, buenos días. Estamos aquí hablando sobre el mercado de seguro y estamos discutiendo cómo puede uno calificar, cómo puede inscribirse. Nuestra organización, el Centro de Apoyo Legal de Charlotte, está dando asistencia gratuita, citas por teléfono que le llamamos y podemos ayudarle a inscribirse en el mercado de seguros. Nosotros ayudamos a ver cuáles son las necesidades que usted tiene para elegir el plan que sería mejor para usted. Tenemos el número de teléfono disponible para que le ayudemos en español y como mencioné, es por teléfono. También está la página web que puede ir a hacer una cita si usted gusta, pero estamos disponibles en español para ayudarles y si usted tiene preguntas sobre su elegibilidad, también nos puede dar una llamada para que le ayudemos.
Thank you, Andrea. Thank you, Devin, for sharing all this information with us, for giving us so much information and to get assistance to people to not miss the deadlines from November 1st to December 15th to apply for or enroll on a plan through Marketplace. Thank you so much. And we don't have any more questions for now. So I'm gonna go ahead and get the word to Maura, which she will do the announcements and any other information regarding Enlace. Thank you.
Thank you, Natalie. Thank you, Andrea and Devin, for that very important information. Hopefully, a lot of people have taken notes. This video, as always, will be on the Enlace Facebook page. Some of the announcements, as you can see on the screen, this Saturday, we are asking the community to come out and join us to do voting at the Spectrum Center from 10 to 1. There will be giveaways. We're going to have some bags and community information, some little giveaways for the first maybe 100 people that show up to come out and vote. We just want to do, Enlace right now has shifted over to do real good and in-depth voter education and outreach to the community. Also, on that same note, on the Enlace Facebook page, you're going to find some mini videos. They're very animated, they're very funny, but also educational. So please take some time, look on the Enlace Facebook page and share the videos. This is just information. It is nonpartisan. This is just information about how to get, what is the bonds. There are several bond issues on the ballot this year. How did you go about voting and what to expect when you go to vote, especially if this is your first time voting. And also, what are the deadlines? What are the deadlines we're looking for? Right now, we're in the early voting stage. That means from as of October the 15th through October 31st, you do not necessarily have to go to your place where you normally vote. There are 33 voting spots all over town. Several of the arenas and stadiums and schools are open for voting. So please, it is safe from what we have been hearing. It is about a 20-minute wait, and you get this neat looking pin, they can use for whatever for the rest of the year. They're not giving out the stickers anymore, they're giving out the pin. So please come out and do your early voting if you are eligible to vote. Share the information on your Facebook page, share the mini videos. And as a preview for next month we're gonna have professional development with a local group from the Wingate University called Alpha. They'll be coming in and discussing some professional development issues. So those are all of the announcements right now, and I'm going to turn it over back to Natalie.
Thank you, Maura. So I hope to see you all on Saturday. We'll be there, as Maura mentioned it. We are going to give aways. We have like a lot of information to share. If you are a first-time voter, we will have a copy of the sample ballot, so you will know what to expect at the polls. So I hope to see everyone. If you want to volunteer, just send an email to Mara or me so we can discuss with you what are the protocols. And also I want to remind you that on the flyer, there is the parking sites. There are gonna be 3 parkings that are gonna be free next to the arena. So so you will have that information as well. And also you can take the train or bus to the arena. That's all for today. Thank you so much to our presenters to give us this great presentation, and also to the Enlace team. And I hope to see you next month. Bye. Thank you.